Here at pre-op, what we actually do is make sure our patients who are having general anaesthetics are actually safe and fit for surgery. We see on average about 50 to 60 patients per day, and we have a mixture of booked appointments and drop-in appointments. We found that the problem we had was that we were having peaks of patients waiting from 11 o'clock in the day, which were causing a massive backlog and long waiting times. Sometimes our patients could be waiting up to 3 hours. So what I actually did, and part of the team, we actually called in our service improvement team, and they helped us look at the different types of data collection and put systems in place to actually collect the data, and then we analysed the data and we started doing the improvements from there. We've smoothed out the day, so we've now got no peaks and troughs. What we've also done is actually reduce the waiting times. The impact it's had on our staff is actually improved staff morale. The staff no longer come into the waiting area and see huge queues of patients, so they're actually being able to spend more quality time with the patients under less pressure. The effect that it's actually having on our patients is that they're receiving a much more of a quality service, and they're more satisfied because they are only waiting for 30 minutes on average.
Still get a lot of people through. In fact, I think we're getting a lot more people through, but it doesn't seem to be such a push, such a stress to get people through, and I think it's a lot better for the patients that way.
As soon as I walked in the door, I was seen straight away by one nurse, taken to the waiting room for about 5 minutes, if that, and then taken through to see Claire.
It's vastly improved. I think because of the waiting times that we had before, it made our lives much more stressful, and because we know the patients aren't waiting for hours, it just helps it helps our day, and I'm sure it helps the patient's day as well.